I fell in love with the specialty. I could not believe the breadth and depth of the specialty.
To work as a team with my patients.
If you make the patients feel a little better about themselves, it just helps them.
There's a certain reward in treating children of every age.
Simply put, the people.
The best patient care advice, and this is still clear in my mind, I was a resident and I had a particularly frustrating interaction with a physician on a consulting service. And I remember my chairman sitting me down at the time and telling me about the 3 A's, and that has really stuck with me. So the 3 A's of affability, availability, and ability. And I think that's so critical, and it's something that I pass on also to my residents.
I recall very vividly my senior partner, the founding member of our group, Dr. Ginsberg, who said that when things get difficult and patients have a serious problem, the best thing that you can do is make the patients feel better about themselves before they leave the office. You always find a little something, a silver lining, even if there's a dire situation.
We operated on a patient with a large skull-base tumor, and prior to surgery she was losing vision. All of her questions basically revolved around whether or not she'd be able to see her son. At the end of surgery, she was actually able to see gradually, and her vision eventually returned back to normal. And every follow-up visit that we have with her, she brings pictures of her son with her, and it's really touching.
This nice little lady from Yugoslavia, she didn't speak much English, but we took a look in her ears to see what was going on and did a good exam. And she turned out she had these huge pieces of wax in both ears, and so we went and took these pieces of wax out, and it seemed like right after I took the wax out, the little baby sort of cried, and this lady, she just lit up and she said, "You know, you helped me live again."
This mother that I had met so many times walked in with her child and her extended family and looked at the family and pointed to me and said, "This is the doctor who told us that we had to own the trach." She told me I had to own the trach. And here they are, they owned the trach. They knew exactly how to take care of their child. They got the confidence to raise their baby. And I can't believe that something that I said impacted them to that degree. That's when I learned about how I am as a clinician, and I feel like I chose the best specialty.